best medical billing software of 2026. Welcome to part 5 of our 10-part series on the best healthcare software in 2026. In this episode, it's all about medical billing software, the tools that turn clinical care into revenue. We'll cover what matters, as well as some of the best platforms for small practices and larger health organizations. Before we dive in, this video is sponsored by several healthcare software leaders, including our title sponsor, athenahealth, as well as our other sponsors and partners, NextGen, drchrono, CareCloud, and TotalMD. What a stellar group of platforms. You can learn more about each of them through the links in the description. Alright, let's dive in. Best medical billing software for small practices. For small practices, medical billing software is often the difference between a financially healthy practice and one that's struggling with collections. The stakes are high. A denial rate that's a few percentage points above average can meaningfully affect practice viability. The best small practice billing platforms integrate with your EHR for seamless charge capture. Manual charge entry is a source of errors and missed charges. The billing system should pull charges directly from clinical documentation. Scrub claims before submission. Pre-submission claim scrubbing catches coding errors, missing information, and payer-specific requirements before claims go out, reducing denial rates significantly. Make denial management manageable. Denied claims should surface in a clear work list with the reason code, the payer-specific requirements, and a workflow for resubmission. Support patient payment collection. Patient financial responsibility is increasing. The billing system should support patient statements, online payment portals, payment plans, and potentially point-of-care collection. Prioritize payer contract management. You're able to track what each payer is supposed to pay for each service and flag underpayments automatically. Clearinghouse connections are important too, i.e. electronic claim submission to all major payers through a clearinghouse connection that handles the technical requirements of EDI transactions. Here are several medical billing platforms consistently chosen by smaller practices. Note, these are listed alphabetically. We don't have time to go through all of them individually, so screenshot and return to this list later, then set up demos. There are also links in the description for detailed feature breakdowns in the SelectHub platform, where you can also look at analyst scores. There you go, some of the best medical billing options for smaller practices. Before we move on, a quick shout out to our title sponsor, athenahealth. Unlike systems that bolt together separate modules, athenahealth, whose Athena One solution provides EHR, practice management, and revenue cycle management, serves medical practices and health systems in one unified system. Their single instance network of over 170,000 clinicians and 117 million patients gives them a scale that's hard to match in ambulatory care. Plus, Athena One is AI native from the ground up. The platform brings AI into the workflows that power ambulatory care, helping practices deliver care, manage revenue, engage patients, and run more consistent day-to-day operations through one connected platform. Thanks to athenahealth for supporting this series. Check them out through the link in the description to see if Athena One is the right fit for your organization. Now, back to the show. Best medical billing software for mid-market organizations. Mid-market healthcare organizations like multi-specialty group practices, regional health systems, and healthcare organizations with dedicated billing departments need billing platforms that can handle volume and complexity while giving administrators the analytics to manage revenue cycle performance proactively. Mid-market medical billing buyers typically look for advanced denial management and appeals automation, systematic denial tracking, root cause analysis by denial category, and automated appeals generation that reduces the manual work of chasing denied claims, contract management and underpayment detection, payer contract terms loaded into the system with automatic flagging when payments fall below contracted rates, protecting revenue that practices often unknowingly leave on the table, coding optimization and compliance, computer-assisted coding suggestions, coding audits, and compliance monitoring that maximize reimbursement while reducing audit risk, patient financial experience tools, upfront cost estimates, pre-visit financial counseling workflows, payment plan management, and self-service payment options that increase patient collections and reduce bad debt, revenue cycle analytics, end-to-end visibility from charge entry to payment posting with performance benchmarking against industry standards, and trend analysis that identifies emerging problems before they become significant. Here are several platforms often chosen by mid-market healthcare organizations. Again, screenshot this list, and there are links in the description for SelectHub's feature-by-feature comparisons and analyst scores. Again, links to the SelectHub platform are in the description. A little extra research now could save you a ton of time and headaches later. Best medical billing software for enterprise health systems. At the enterprise level, medical billing is a revenue cycle operation managed managing tens of millions of dollars in claims per month across multiple facilities, specialties, and payer contracts. The platforms that serve this market are sophisticated revenue cycle management systems, not just billing tools. Enterprise medical billing platforms need to support enterprise revenue cycle management, end-to-end RCM from pre-registration and eligibility verification through final payment resolution, spanning professional and facility billing across the entire enterprise, payer intelligence and contract analytics, comprehensive payer performance analytics, contract modeling for renegotiations, and payer trend analysis, patient access and financial clearance, enterprise patient access systems that handle prior authorization at scale, financial counseling workflows, and charity care determination, all before the clinical encounter begins, integration with the full healthcare enterprise, connections to the EHR, the hospital information system, the cost accounting system, and financial reporting. So revenue cycle data connects to the full financial picture of the organization. AI-powered claim optimization, machine learning models that predict denial risk before submission, suggest coding improvements, and prioritize AR work queues by expected return on effort. Here are several platforms consistently chosen by large enterprise health systems. Screenshot this list and dive into the links for SelectHub's feature-by-feature comparisons and analyst scores. Links to the SelectHub platform are in the description. There you have it, an overview of the best medical billing software in 2026, from smaller practices through to enterprise health systems. For more resources, including pricing guides and SelectHub's database of feature comparisons, check out the links in the description. One more big thank you to the sponsors who made this series possible, including our title sponsor, athenahealth, as well as our other sponsors and partners, NextGen, drchrono, CareCloud, and TotalMD. Each of these brings unique value depending on your organization's size, specialty, and revenue cycle complexity. Links to book demos are in the description. I'm Devin Hennig with SelectHub. Thanks for watching, and we'll see you next time. Cheers!